Regenerative Holistic Dentistry. When we talk about regeneration in holistic dentistry, we usually talk about exosomes, peptides, PRF, injections, ozone, and laser treatment. So let's start with peptides. What used to be available only for pro athletes as performance enhancement is not readily available in most functional medicine practices, right? So we probably have heard of BPC 157, or growth hormone peptides, or TB4. They reduce inflammation and bacterial load. Exosomes, maybe some of you might have heard of stem cells. So exosomes, those tiny vesicles that are released from different cell lines, let's say from bone cells or from white blood cells. They enhance cell-to-cell communication that's so essential to the cell itself, to its health. So mixed with PRF, it reduces sensitivity, it expedites healing of the bone and nerve healing, helps regenerate bone tissue, nerve tissue, gingival tissue. And of course, I keep on saying along with PRF injections. So what is PRF? And maybe some of you heard PRP treatment from your functional medicine doctor. So there's a difference. And the way I usually explain to my patients, I give this example. For example, I go play tennis and I got blister on the bottom of my foot. What's going to happen? In a couple of days, I will start healing. In a couple of weeks, I will practically will forget about the blister and this incident. Now, imagine I played with my friend who has diabetes. Now, we all know diabetics don't heal. Why? Because they have compromised healing, compromised microcirculation. So what's going to happen? His blister will start ulcerating. The ulcer will grow bigger. At some point, it can get infected. And if he can get in the hospital, he might be looking at amputation. So that's where scientists thought, what if we're going to get this patient's blood, spin it, separate it by cellular levels, and get it in the syringe so we can inject it in those areas where there's compromise, right? Let's see if we can regenerate the tissue. We can get the red blood cells and white blood cells and platelets and growth factors. This is how PRP concept, this treatment, was born. Now, the only drawback is that we have to add anticoagulant to the mix so that the blood will not clot. And maybe you recall, if you go get your blood drawn in the lab, sometimes they shake those tubes because there's a little bit of liquid. This is anticoagulant. Again, they add it in the tube so the blood will not clot. But we know that the first step in any healing is a clot formation. So that's why adding anticoagulant, it's a little bit of hindering effect on the regeneration. So fast forward 50 years, cardiac researchers were looking for the new biomaterial that will, for the heart valves, that will never clot. And so that's how they came across those hydrophobic surfaces. And this is what we use in our new tubes. So PRF, because we're using those tubes, we don't have to add anticoagulant. So now we have advantage of your own red blood cells, white blood cells line, your platelets, your growth factors. We spin and concentrate it and put it in a syringe, and we inject those areas. Where do we use PRF? Again, for regenerative purposes, for bone healing, after extractions, after cavitation surgery, any infection, for gum disease, for sinus issues with the sinus. It has many for facial aesthetics, for hair growth. We can use your own, basically your own stem cell lines to regenerate. Of course, we supplement with ozone and laser treatment as a part of holistic treatment.